International anti-epidemic figure, Professor Chen Hailin. At 1:45 a.m. on January 21, 2020, the Wuhan Municipal Health Commission announced through its official Weibo that a total of 15 medical staff in the city were diagnosed with pneumonia cases of new coronavirus infection, and another one was a suspected case. Among the 16 patients, one was in critical condition. Previously, regarding the prevention and control of the "new coronavirus-infected pneumonia epidemic," academician Zhong Nanshan, leader of the high-level expert group of the National Health Commission, revealed in response to reporters and APO's questions that surrounding a patient infected with the new coronavirus, because of various aspects of care, 14 medical staff were infected. As researchers deepen their understanding of the virus, from "no clear evidence of human-to-human transmission was found," to "the possibility of limited human-to-human transmission cannot be ruled out," to "can be transmitted from human to human," the changes in the spread of the virus suggest that the Wuhan novel coronavirus the virus is gaining strength. The emergence of supercommunicators has made the Wuhan epidemic develop from a "worrying state" to an "extremely worrying state." The infection of this virus has just begun and is in the climbing stage. On January 20, Zhong Nanshan released at least 3 times in an interview with CCTV that the virus infection is getting stronger. One of the bases for "the virus has become stronger," is that it can be transmitted from person to person. The virus is transmitted from person to person, and infection among medical staff is one of the clear evidences. On January 21, the Wuhan Municipal Health Commission reported that a total of 15 medical staff in Wuhan were diagnosed with pneumonia cases of new coronavirus infection, and one was a suspected case. According to the information provided by Zhong Nanshan, one patient infected 14 medical staff. This situation of one person infecting many people is not unfamiliar. There were many similar cases in the SARS epidemic that spread in China from 2002 to 2003. Such patients who can transmit the virus to more than 10 people are called superspreaders. Superspreaders cannot be predicted in advance and need to be determined based on the number of people they infect. During SARS, a man in Guangdong became ill for 50 days and infected more than 130 people, including 18 relatives and dozens of medical staff. He was called a "SARS superspreader." At that time, the role of superspreaders was underestimated, which led to the widespread spread of the SARS virus. The key to preventing the spread of the virus is to be alert to possible superspreaders during the spread. At 4 p.m. on January 21, Zhong Nanshan said at a press conference introducing the new coronavirus pneumonia epidemic and prevention and control situations in Guangdong province that the biggest worry now is the emergence of supercommunicators. Kaijing reporters learned from many knowledgeable experts that as the number of cases increases, especially the emergence of contact with infected persons and family cluster cases, it is suggested that the virus is transmitted from person to person. End quote. But judging from the current situation, the virus and APO's transmissibility is limited, and its effect on human-to-human transmission is relatively mild. End quote. There is a certain process for a virus from its emergence to its demise. The condition for extinction is that the existing density is insufficient to support the survival and reproduction of the virus as a population. Most commonly, there is a lack of cellular hosts for viral replication, such as isolation of people who are already infected or in the latent phase. Therefore, how to effectively prevent and control the epidemic should attract more attention from relevant departments. The virus will change. As of 2400 hours on January 20th, the National Health Commission reported that China has reported a total of 291 confirmed cases of pneumonia caused by the new coronavirus infection, from Wuhan, Hubei, Beijing, Guangdong Province and Shanghai. At the same time, a total of 54 suspected cases were reported in 14 provinces, autonomous regions and municipalities. Judging from the current situation, and quote, compared with the SARS virus in its extreme stage, the new virus is not so contagious and not so virulent, end quote, Zhong Nanshan said in an interview with the media. Xu Xiaoyuan, director of the Department of Infectious Diseases at Peking University School of Medicine, told Kaijing reporters that judging from the current situation, the spread of the new coronavirus this time is relatively limited and has not been passed from the second generation to the third generation. End quote, it spreads from person to person. End quote. The effect is relatively mild. End quote. Clinical treatment of severe and critical patients with novel coronavirus pneumonia and sequelae of recovery. Professor Chen Hailin and Professor Luo Yuasia from the Research Institute of Beijing Liminyuan International Hospital of Traditional Chinese Medicine, Pathology 1, sequelae of recovery from critical illness caused by novel coronavirus pneumonia. Zhong Pingjun, male, 71 years old, military doctor, Building 14, Pingqing Garden, Zudong Street, Hongshan District, Wuhan City, Hubei Province, went to hospital on April 23, 2020. The patient suffered from sequelae of recovery from the new coronavirus. Chief complaint: the patient found that he had chest tightness, tightness of breath, shortness of breath, and upset, which had worsened in recent days. Clinical manifestations: progressive dyspnea, with influenza-like illness before onset. Dry cough is accompanied by weakness and weight loss. In the early stage, the patient is short of breath only during activity. Later, it develops to difficulty breathing even at rest. When complicated by respiratory tract infection, there may be fever, cough, phlegm, and conscious chest tightness. The course of the disease usually progresses rapidly. The theory of febrile diseases developed into the Qing dynasty and has formed a relatively complete theoretical system. On the special treatises on febrile diseases, the four most famous ones are Yi Qianqi, Zhu Xingbai, Wu Jutong and Wei Menjin. Among them, Yi Qianqi is especially famous. He wrote about the plague. Explanation: warm evil affects the lungs first and then travels backward to the pericardium. This coincides with the current transmission route of COVID-19. Physical examination may be negative in the early stage. Dyspnea and cyanosis may be significant in moderate VIR patients. Thoracic expansion and diaphragmatic activity are reduced. Breathing sounds are coarse. Crackles can be heard at the base of both lungs. Clubbing of the fingers is obvious, but there is no hypertrophy. Osteoarthrosis. X-ray manifestations in the early stage of alveolar apex chest when pulmonary hypertension is large. The transverse diameter of the pulmonary artery trunk increases and the diaphragm on both sides rises. Occasionally, the pleura is thickened, but pleural effusion is rare. In the late stage, the nodular shadow thickens and multiple ring-shaped identified areas appear. The honeycomb lung CT examination, critically ill patients. CT examination, increased texture in both lungs, slight pleural adhesion in some edge areas, diffuse cloudy slightly high-density blurry shadows in both lungs, some showing ground glass changes, multiple spots in both lungs with unclear boundaries and uneven density. With the lungs the distribution in the field is with increased and blurred lung texture. Bilateral interpulmonary fibrosis and bronchiectasis. Dialectical syndrome, evil heat congesting the lungs, phlegm and dampness binding the chest, heart and kidney disharmony, and qi and yin deficiency. Function: moisten the lungs and nourish the kidneys, raise yang and resolve turbidity, phlegm and dampness, disperse stagnation and dissipate phlegm, warm the spleen and strengthen the stomach, replenish qi and nourish blood. History of current illness: the patient developed cough and chest tightness on January 17, 2020. He underwent CT lung plus mediastinum, plain scan MPN, at Zhongyan Hospital of Wuhan University on January 17, 2020. No PO 5595, partial margin. The image shows symmetrical thorax, multiple, thickened, and blurred textures in the lung fields on both sides. The pleura in the marginal area is slightly thickened. Multiple hairs in Xuanglu disappear in winter, but on the 8th day of the year, the wind changes and the symptoms change in both lungs. Air cavity shadows: the larger ones are 50 by 60 centimeters in size and have obvious solid pathological changes. The bronchi of both lungs are unobstructed, the hilum of both lungs is not large, there is no definite lymphadenopathy in the mediastinum, and the bilateral pleural cavities are. No signs of effusion were seen. Localized calcifications in the left coronary artery and aortic arch are visible, and the size and shape of the cardiac shadow are. No abnormalities were found, and no effusion was found in the pericardial cavity. Comments: 1. Bronchitis. 2. Multiple bullae formed in both lungs. 3. Multiple old fibrous cord lesions in both lungs with mild interstitial changes. 4. Localized calcification plaque formation in the left coronary artery and aortic arch. Follow the doctor and APO's advice and continue to take traditional Chinese medicine 20-30 g of ginseng and 15-25 g of Aphiapagan japonicus. Occur during virus replication, and physical and chemical mutagens can increase the probability of such mutations. After mutation, the virulence and other characteristics of the virus will change. The virus causing pneumonia of unknown origin in Wuhan is the same as SARS, a coronavirus. Current research progress is that the coronavirus family includes nearly 20 viruses of the genera alpha, beta, gamma, and of which 6 are known to be able to infect humans. Under a microscope, the virus has obvious protrusions of rod-shaped particles on its outer mold, which makes it look like a medieval European imperial crown, hence the name and quote, coronavirus end quote. The virus was first isolated from chickens more than 80 years ago. In 1965, scientists isolated the first human coronavirus. Viruses are simple microorganisms composed of nucleic acid and protein shells, including DNA and RNA viruses. Coronaviruses are RNA viruses. The variability of coronavirus is very high because of the very high recombination rate between its RNA and RNA. That is, the genetic material that determines its viral properties is constantly changing. Among the coronaviruses that can infect the human body, 4 of them are relatively common in the population, have low pathogenicity, and generally only cause mild respiratory symptoms similar to a common cold. The other 2, SARS and MERS-CoV, can cause severe respiratory illness. The former, SARS, had obvious human-to-human transmission, causing the disease to spread rapidly. In 2004, the research team of Wang Fuxing, then Deputy Director of the Institute of Infectious Diseases of the 302 Hospital of the People and APO's Liberation Army, studied SARS virus specimens and found that there were more than 110 mutated sites in the full-length S gene of the SARS virus. The Wuhan new coronavirus and SARS virus both belong to the beta genus of the coronavirus family. Nancy Messonnier, director of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention, CDC, previously said that it does not take long to go from a state of concern to an state of extreme concern. Zhen Guang, a member of the National Health Commission's high-level expert group and chief epidemiologist at the Chinese Center for Disease Control and Prevention, mentioned in an interview with the media that Wuhan has now entered the early stages of community transmission. He reminded that infection among the elderly is a priority, especially for patients with chronic diseases. During the SARS period, a WHO spokesperson once introduced materials on super spreaders, most of whom are elderly, chronically ill, or patients with chronic diseases. On January 15, Li Xingwang from the Infection Center of Beijing Dighton Hospital affiliated to Capital Medical University mentioned in a training that critical illness accounts for about 15%. Most of them are the elderly, those with underlying diseases and those who are obese. And quote, the severe disease rate is 14% and the fatality rate is 4%. End quote. On January 20th, an informed expert gave this data when he told Caijing reporters about the physical condition of patients infected with the new coronavirus in Wuhan. According to statistics from the World Health Organization, WHO, as of November 2019, there were 8,273 cases of SARS virus infection worldwide, 775 deaths, and a fatality rate of 9.3%. At present, the fatality rate of the new Wuhan virus is lower than that of the SARS virus. Compared with the power of the SARS virus, the fatality rate of the Wuhan new virus is lower. And quote, the current fatality rate cannot tell the whole story. It depends on the development of the disease. Zhong Nanshan once again emphasized in the interview that at this stage, the virus is only in its infancy and is strengthening.